Right, so if you have read and understood considering the surgical and augmentation, kindly tell me what are you looking at?
This is a cross-sected image of the right popliteal fossa.
Yes. Okay, can you please tell me the boundary of popliteal fossa?
Superior laterally, there is the biceps femoris. Superior medially, the semimembranosus and semitendinosus. Inferiorly, there is on the lateral side, lateral head of gastrocnemius, and medially, medial head of gastrocnemius. The roof is formed by the fascia, and the floor is formed by the posterior surface of the femur and popliteal muscle.
What are the contents of popliteal fossa?
Ma'am, the common peroneal nerve, the tibial nerve, popliteal vein, popliteal artery, lymph nodes, and the termination of soft penicillin.
Okay, good. Can you tell me if there is a swelling on the back of the knee or in the popliteal fossa? So what are the differential diagnoses that you'll think of ruling
It
out?
could be a lipoma, sebaceous cyst, a Baker's cyst. It could be a popliteal artery aneurysm or a varicosity of the popliteal vein or a schwannoma of the nerves.
Good. Okay, can you please tell me from superficial to deep, what is the deepest structure found in the popliteal fossa?
And the popliteal artery lies deepest in the popliteal fossa.
Okay, good. If you're asked to feel the pulses of the popliteal fossa, how would you do it? What is the right mechanism or right technique of feeling the pulse?
Ma'am, we will ask the patient to flex his knee at 30 degrees and we will
Yes.
feel for the popliteal pulse in the lower half of the popliteal fossa on both the sides
Yes.
and palpate it against the posterior surface of the ankle, knee joint.
Knee joint. Okay, good. Can you please tell me what type of joint is knee joint?
And synovial type of knee joint.
Okay, how is the knee joint formed?
By the distal
yeah,
condyles
yeah.
of the femur and the proximal condyles of the tibia, and the knee joint is a joint formed by two joints. One is the tibiofibular, the femur and the tibia, and the other joint is between the patella and the femur. The joint between the tibia and the femur is between the two condyles of the two bones, and the posterior surface of the patella articulates with the anterior surface of the tibia.
Okay.
Femur.
What type of bone is patella?
Patella is the sesamoid type of bone. It is the largest sesamoid bone of the body.
Yes. Can you name other sesamoid bones in the body?
Scaphoid bone and a navicular bone.
Okay, good. If you are asked to check the knee reflex, can you demonstrate it on a patient and tell us?
Yes, ma'am. The patient will be asked to keep his legs relaxed off the ground and flexed, and then we will expose the thigh. Then we will use the hammer to tap on the patellar tendon and look for contraction in the quadriceps muscle.
Okay. What would you be exposing? Exposure will be
the thigh muscle.
thigh. Very good. Okay. Once you're checking for the knee reflex, what are the root values that you're checking?
Ma'am, we are checking for the extension. The root values are L3, L4.
Okay. What are the movements which are present or which are exhibited at the knee joint?
Flexion, extension, internal rotation, and external rotation to some extent.
What stabilizes the knee joint?
The ligaments and the menisci are present, which stabilize the knee joint. The anterior cruciate ligament, the posterior cruciate ligament are the intracapsular ligaments. There are also menisci between the two condyles of the bone on the proximal side of the tibia. Extracapsularly, there is the medial collateral ligament, the lateral collateral ligament, and the patellar ligament.
What is the
posteriorly
role?
Is the oblique popliteal ligament.
Okay. What is the role of menisci in the knee joint, in the stabilization of the knee joint?
they act as cushions,
Yes.
and they are also deepen the tibial plateau, ma'am.
Good.
Deepen the tibial articular surface.
In which position knee joint is weakest?
Ma'am, flexion.
Yes. Good.
Flexion.
Okay. Right. If a patient comes to you with the knee swelling, how would you rule out which are the most commonly injured tendons that you would rule out first?
Ma'am, the quadriceps tendon and the
And the
biceps
ligaments
femoris tendon.
and the ligaments. In what kind of
And
injury would a patient come to you with those tendon injuries? Can you explain the mechanism or mode of injury?
Ma'am, it could be a sporting injury where the patient could fall in an
Without warming up.
flexed
Yes.
lateral rotation of the knee joint or medial rotation on a flexed knee joint.
Which ligament is the most commonly injured?
Anterior cruciate ligament.
Okay, it is mostly associated with any other ligament. How would you medial cruciate? How would you confirm?
The anterior draw test.
Yes, how is it done?
I'm keeping the knee in flexion. We will take our hands to the back of the calf of the patient, and then we will pull the. I'll get back to you with that.
Okay, can you please tell me the attachment of the medial collateral ligament?
It is from the medial epicondyle of the femur to the medial condyle of the tibia.
Okay. In what kind of scenarios patient comes with fibular injury of the fibular ligament or the lateral ligament? Can you explain the mode of injury?
The lateral collateral ligament.
Yes, lateral or fibular.
Extensive lateral rotation of the knee.
Direct injury. Okay, can you please tell me how would you suggest to manage a patient with ligamental injury? How should the patient be managed?
Ma'am, firstly, he should be given the RICE therapy, that is rest, ice, and compression. And then after that, maybe an MRI scan should be done to diagnose the extent of the injury.
Okay.
And then if there is an injury, an arthroscopy can be done and a repair arthroscopically can be planned.
All right, thank you. And here is your question.